Dr. David Klein, I want to welcome you to the show again, the Rob Newton Resource Hour. You know, it seems like everything we read these days, every time we turn on the radio, the television, except this hour, we're getting negative news, and a lot of people are just flat getting depressed, and then there's the clinically depressed. So let's talk about depression, life, and how people can just get a better outlook, and I don't know if that's nutraceuticals. I don't know what that is.
Okay, well, for starters, depression is very, very common. An average adult is likely to develop a clinical depression in their life, the likelihood being about 60 to 70%. Of those individuals, the likelihood of recurrent depression is about 16% per year. Okay, this is a big deal. What causes depression? Many things. What can be used to treat it? It depends upon the circumstance. One of the things I like to instruct my patients with is this. If you were to hit yourself with a nail gun, you shoot yourself in the leg with a nail gun, what is the most effective pain medication you can take? The answer being a pair of pliers. Okay, it's not necessarily a pill or a treatment, but it has to be the right one for the circumstance. So if you lose a pet, you lose a loved one, you're likely to go through a grieving process that's going to take a year with or without your doctor's intervention. On the other hand, if you have a situation whereby you're depressed, you can't seem to get things going, you can't sleep at night, or you wake up in the middle of the night or very early in the morning, your appetite has gone a little bit wonky, you can't interact as you did, and there's no apparent cause for this. Okay, this is what's called an endogenous depression, and it may well need to be treated. Depression is very, very common. So where do you see this? How do you see it in your friends? How do you see it in yourself? Well, typically, men treat depression differently than women do. Self-treatment is this. One, men drink. How interesting. Okay, that's how men deal with depression. They go out with the boys, they go out alone, or they sit at home alone and drink. Women, on the other hand, may do that, but more than likely they will eat. These are the two differences between men and women. It has something to do with the biochemistry.
I thought they shopped.
They do that too, actually. What they call that, retail therapy. There are lots of different ways that people deal with depression. Okay, some of them are more, let's say, socially appropriate than others. Well, here's the deal. Okay, if you can't get to sleep at night, whether it's due to noise, whether it's due to somebody around you, whether it's due to pressures of life, okay, you are going to make yourself depressed. Certain biochemical changes will occur in your brain, whether you want them to or not. They're going to happen, that inside of 3 to 6 weeks, you will become clinically depressed, and it may or may not be permanent. This is very important, especially for kids who go to sleep with cell phones. If they can't get a good night's rest, psychiatrically, they change, and it does not take long for this to occur, and frequently the changes are not easily, if ever, returned to normal. So why is this? Well, let's take a ride back in time to the 1950s, to the Korean War, something called the Chinese water torture. GIs that were captured. Okay, interrogation technique meant lying on your back and a drop of water was dropped on your forehead at intervals of about a second. Now, that doesn't sound like a great deal. It certainly doesn't sound like waterboarding. But the effect is about the same. Several days later, you can't concentrate, you can't sleep, and after about 6 to 7 days, you're going completely out of your mind. If you deprive anybody of sleep for as long as 2 to 3 weeks, they can die as a result of this. This is no joke. So you don't think that the noises outside, traffic noises, sirens, and so on and so forth, can't cause a psychiatric illness? You'd be wrong. So here's the deal. How do you diagnose depression? Look at the individual. It's very, very easy to see anhedonia, or lack of ability to seek pleasure or to be happy with things. Inability to focus, inability to sleep, changes in bladder and bowel. Basically, it's almost every type of constitutional symptom will reflect itself in a type of depression. Well, good. Okay, now what do we do about it? You can drink, you can smoke, you can eat, you can do drugs. Not good long-term strategies for the most part, but in terms of intervention, there are several amino acids, there are several neurotransmitters that are very, very important in the modulation of affect, or what you would see as emotion. So 5-hydroxytryptophan is one of them, the serotonin. Okay, what happens with serotonin, okay, is that it is the principal modulator that in lower, let's say lower levels, leads to certain types of depression. So very, very commonly we give our patients serotonergics. Oh, gee, wonderful. prescription items. They do work, sometimes rather temporarily, unfortunately. Selective serotonin reuptake inhibitors, or SSRIs, SNRIs, all very, very useful, sometimes very difficult to come off once you're on them. So alternative to this is 5-HTP, which is the immediate serotonin precursor. It's over the counter, and if you're careful with its use, underscore, bold, italicized, careful, you can treat yourself, your loved ones, with 5-hydroxytryptophan for depression. The way I typically start my patients is 200 milligrams at bedtime, wait a week or two, then go to 100 milligrams twice daily with 200 at bedtime. Understand the risks if you're already on SSRIs or SNRIs. You have to cut the dosage back because you are going to find that those medications that you're on all of a sudden start to work again because the substrate has been missing and now you're restoring it. Well, how else do we look at depression? There's something called dopamine. Now, this particular amino acid, this particular neurotransmitter, is very well recognized to individuals that understand happiness. They understand cocaine. They understand alcohol, nicotine, and so on and so forth, even still understanding Parkinson's disease, because this particular neurotransmitter is involved in all of the above. So how do we deal with that? Well, again, you can use medications like Wellbutrin, which is a wonderful medication. It does not seem to have the same tachyphylaxis, or that's a medical term for it stopped working. Gee wonder. It will continue to work as long as your body has the appropriate substrates leading to the production, manufacture, and distribution of dopamine. That would be tyrosine. So you can take tyrosine, L-tyrosine in your diet. The nutraceuticals are a cheaper way to get it done, and this, in fact, will give you a good boost if, in fact, it's the dopamine receptors that are at issue. Glycine is the most common. It's the ubiquitous. It is the most prevalent of all neurotransmitters, and it's one that tends to get lost in the writing. People don't look at glycine. So I take my patients and I'll start them on glutamic acid combined with glycine. This is particularly useful in individuals that have a type of depression called bipolar. Okay, you'll hear this up and back. Bipolar 1, bipolar 2, bipolar slow cycling. Okay, but the combination of glycine and glutamic acid in the form of L-glutamine is extremely beneficial in the self-treatment and, in fact, in the pharmaceutical treatment of patients with this disorder.
All right, very good. And again, you mentioned some of the things that we can get over the counter. You mentioned 5-HTP and some of that sort of thing. So that's very easily attainable at the stages of life, whether we go on the net or we visit.
Oh, we distribute it, because it's so important. I'd like to think that when you go out shopping for these things, that you would take the time to make sure that it's pharmaceutical grade, and it makes all the difference in the world. And none of these are expensive. You can get the top drawer. You can get the Cadillac, the Rolls-Royce quality for very, very little money. You do not need to spend a lot of money to treat this. But again, in the treatment of depression, you can look at the neurotransmitters. Again, tyrosine being the dopaminergic precursor, 5-HTP being the serotonin precursor, L-glycine and L-glutamine for dealing with the NMDA receptor with bipolar. But then again, last and probably not the least, is melatonin. Why? Because if you can't get a good night's rest, anybody is going to get depressed. Deprive somebody of sleep, they will become depressed in 3 to 4 days. Irreparable damage is done at 6 weeks. So we almost always add melatonin. The dosage is adjusted for age, it's adjusted for gender, and whether or not you're taking, oddly enough, pain medications.
And I tell you what, when I take my 5-HTP and I take my melatonin, and there's something else I take at night. Oh, L-theanine.
L-theanine.
I'm done. I'm gone in 10 minutes.
Yeah, well, and that, you're not taking them under my direction for no particular reason, okay? It's a matter of resetting the machine after a stressful week. I take them also in exactly the same dosage that you're taking, and while I may have been treated, well, it's possible I may have been treated for depression in the past, let's say, not anymore, and probably not again. And how do I do it? By replacing, by supplying, and by using these medications, oddly enough, under my own direction, which is kind of an odd thing to say, but I couldn't find a better doc, so therefore I'm going to do it.
I like it. All right. Robin, could you give us all the contact information, everything we need to know so that we can be like Dr. Dave?
You can give the office a call at 407-679-3337, and you can find us on the web at www.stagesoflife.net. Our health store is open during our office hours, which are Monday through Thursday. And when you're on the web, you can click on the vitamins and mineral tab, and you can get to our online store and purchase those nutraceuticals right there.